From serene villages to rolling hills and the peaceful waters of the Volta River, the Volta region is rich in culture and community spirit. But behind this beauty is a pressing need for improved healthcare infrastructure. Chief Executive Officer of the Whole Teaching Hospital, Dr. John Tampuri, says the newly established Infectious Disease Center is driving the change that is much desired.
The hospital was built to take care of about 214 patients. That is the ward state. Currently, we operate a state that is getting close to 400. Now, that obviously tells you that there's the need for additional space.
Dr. Tampuri opines that the continuous expansion and renovation of facilities has not only resulted in improved quality healthcare, but also positively affected the local economy and brought the hospital closer to the vision of becoming a hub for healthcare delivery within the sub-region.
So for us, we're excited when COVID came in and the ministry decided to get us an additional facility to handle the infectious disease. That facility has been enhanced, and now that the pandemic is down, it's being used for other services. We have very good theater facilities there, ICU facility, and surgical facilities. All these are supported by some laundry services. Accommodation is an issue though, but there are constructions going on to add some additional accommodation to help some staff stationed 24/7 in the facility. We also have an oxygen plant on standby to help with the supply of oxygen for oxygen therapy and support for surgeries and so on. In addition to that, we have a manifold facility that can help us use oxygen cylinders to support the activities of the PSA that has been provided. Not forgetting the people around the area. So an OPD facility has been opened and developed and is operational, basically to support the surrounding population. It's a kind of social responsibility. So there is a Ghana Health Service Health Center not very far away, but we go beyond that to try to give some specialized services so that people from the eastern side coming in can actually have some of the services there without moving all the way to home.
Adaklu is not the only beneficiary of an infectious disease center. In Keta, a 20-bed capacity facility has been built and currently in use. The medical superintendent, Dr. Kofi Kakari Bonsu, speaks highly of the quality of work delivered and how it has transformed service delivery there.
Okay, so the infectious unit was completed in 2023 and it's a 20-bed capacity, and it comes with an incinerator and a genset. And within the infectious unit, we have an ICU, we have a female ward, we have a male ward, we have a pediatric ward. And this actually serving the people of Keta very well, because as it was completed, our aim was to get the infectious cases, quarantine them there and serve them. But since it was completed, we don't have any infectious case. So we are using mainly the ICU, the intensive care unit. Because this hospital will not have any intensive care unit. But as the infectious unit was established with intensive care unit, that's what we are using. And also the special wards within it, we are using to cater for VIP patients within the municipality, and also our own staff who are sick. We don't mix them with the general ward. We move them to the infectious unit because the wards are very special to us.
Actually, I would say that when the COVID came, that was where government responded to the needs of the time by putting up that infectious disease center. and I have to commend government by all standard. Today we can say that though we don't have those kind of infectious diseases, but the place is a saving grace. Why do I say so? Recently, a friend of mine had a problem, and when he went to the hospital because of the congestion, that was where he was actually admitted. And when you go to the place, it's more or less like UGMC in Keta. Very beautiful. You enter, I think you were there yourself. And so we can only say that it has come at the right time, that we're not even expecting it. So mostly we say that in Keta, the COVID-19 has come as a blessing to us, because today when you visit that place, you see that edifice, and it is just amazing that today we can also boast of such a facility in Keta.
I think it's improving the healthcare delivery within the municipality, and I think as now we are having this monkeypox and other infectious disease coming up, we will actually use it to serve the people when they get those diseases. It also has a laboratory unit inside. It comes with a mobile X-ray. Currently, we are using the mobile X-ray. So those who come in emergency that cannot be wheeled to the emergency, the X-ray department to take an X-ray, we use the mobile X-ray to help them. And it's the laboratory equipment too. When there's a pressure at our main laboratory, we send some patient there to also use that place as the means of getting their lab being done. So I think it's really helping us. It's like a backup for us.
The people of Aplau were also not left out. With a strategic positioning close to the border, the relevance of this infectious disease center cannot be overemphasized.
The infectious disease center is of a bed capacity 21, and indeed we have some equipment there. That's a hematology analyzer, chemistry analyzer, infusing pump, patients monitor, and PRC, which is used for detecting infections. And indeed, the benefits holistically is about to improve quality of service in the area of infection prevention, disease control. So it's basically around that area. In this area, to looking at the geographical location, where people cross the border, the flows is in and out. Emerging diseases is also popping up. So basically, the center will be there to help us achieve providing quality care to the people of Ketu South Municipality and beyond.
This facility is the first ever district hospital in the area.
Ketu North Municipal Hospital was inaugurated by His Excellency Nana Addo Dankwa Akufo-Addo in the year 2020, and we start operationalization in the year 2022, March. So it's a 60-bed capacity hospital, and we provide every kind of service. We run 24 hours services to our clients. We do outpatient, inpatient. We have children and maternity wards. We have wards for male and female. We have emergency wards as well. So we have all departments. We have pharmacy and mortuary, and also we have our administration block, lab as well. We were using the CHAG facility, which is about 40 minutes from here. That's in Joje. And we also have a mission hospital across the road. So this is our first municipal hospital for this area, and it serves people far and near, even beyond the Ketu North municipality.
According to the medical director, the facility is well equipped to the excitement of medical staff there and generating positive feedback from the patients.
This place is well equipped. We have a lot of equipment, so we are well resourced. So the staff are happy about that, and they are excited to work here.
Today, the people of Volta in the Ketu North area can boast of a new and modern facility designed to meet their health needs.
These projects represent the fulfillment of the Akufo-Addo government's commitment to achieving universal health coverage and ensuring the delivery of more efficient healthcare services across the country. From 2017 to August this year, we've added some 8,665 hospital beds for admission, i.e., from 24,153 hospital beds in 2016 to 32,818 hospital beds by August 2024, representing a rise of some 36%, further underscoring our commitment to expanding healthcare infrastructure. This excludes the total number of beds to be provided by the Agenda 111 project. We've also made significant strides in reducing maternal, adolescent, and child mortality rates. The institutional maternal mortality ratio, IMMR.
The expansion of the National Health Insurance Scheme and the introduction of digital healthcare services are pivotal in achieving universal healthcare. These initiatives ensure that every citizen, no matter their location, receives the care they need.
The National eHealth project has been deployed as a holistic healthcare platform. Real-time data collection from connected linked facilities has provided health stakeholders and disease control experts a unique opportunity to enable health policy decisions for the entire health continuum in a manner never envisioned before. 6 teaching hospitals, 10 regional hospitals, 243 hospitals, 3 psychiatric hospitals, and 50 polyclinics are all deployed with links, with over 1,000 health centers deployment currently ongoing at the moment. This is really massive when you think about it. I believe Ghana has reached a major milestone today, and I keep saying it is possible.
Well, I think I was fortunate to be part of the 7th Parliament of the 4th Republic, and it is very heartwarming to say that most of the facilities or the funds for building these hospitals came in during the first term of the Akufo-Addo government. And fortunately, that time, COVID had not struck. COVID struck at the latter part of the first term.
We have put in some mechanism for almost every project we execute. We have a minimum of 3 years maintenance agreement that is factored as part of the project. So that once the project begins to run, you hand over the project and it has to run for about 3 years. In the case of the equipment, there's what we call a mandatory warranty, 12 months mandatory warranty. That is part of the project. But aside that, we also try and build in that 3-year maintenance period so that we can be able to maintain the project along the line. As part of our capital investment infrastructure structure that we're going to launch out soon, we've also indicated that institutions are supposed to set up a maintenance fund dedicated towards the maintenance of these facilities. Once you maintain the facility, you'll be able to realize the full realization of the project. Even look at the fact that you can expand the lifespan of this project. So moving forward, maintenance culture is something that we want our institution to really inculcate so that at the end of the day, it can provide a more efficient, a more robust health system.
Sometimes it takes some period for people to realize the investments that have been made in their lives. I remember some few years back, people go like, oh, show one hospital that you've built. And all of a sudden, everywhere you go, every Ghanaian is realizing that this government has been one of the most courageous. $1.765 billion. That is the cost of the Agenda 111 project. $1.765 billion. And this is outside all the facilities I've mentioned. La Agenda 50 million euros is not part of this. 90 million euros at Efia Quanta is not part of it. 70 million euros at East Regional Hospital is not part of this. The Vamed Clinic, 70 million euros is not part of this. The Urology and Nephrology Center is not part of this. All the facilities are not part of this. Agenda 111 alone. And I'm happy that when you go to Pram Pram, you now start seeing Agenda 111. When you go to Ashanti region, you see Agenda 111. And by the grace of God, President Akufo-Addo, before he hands over power to the leader that God himself is going to give us. My belief that is going to be Dr. Bawumia, is going to commission some of the Agenda 111 projects. My wish as the Minister for Health for this Republic, that every promise, every undertaking of this government, even for those that were seen in the beginning as being unreal, it is my prayer that just as my uncle and beloved Domahini said, it's my prayer that every Ghanaian will realize that when we dream it, it is possible. That when we desire it, it is possible. That when we work for it, it is possible. It is only when we dream it, desire it, and work towards it that we can have the Ghana that we all want.
It is expected that these facilities would heavily augment the professional services of health workers in this region.
Now the staff number, if you relate it to the time I joined, has grown about tenfold. What it therefore means that it has provided job opportunities for a lot of young people who have been roaming around in the street. So that is the kind of effect that is having on the environment and on the people. It's not only that, health delivery goes with other businesses. You have people who come, they need to go and do photocopy, they need to go and do lamination of their cards and so on. So that gives opportunity for businesses to grow around the facility. Some relatives come to visit patients. They need a place to stay around, possibly to support the care of the patient for a day or two. That means that they will need to look for guest houses and so on. This is also creating job opportunities for the community.
Most of the infectious diseases that we have around this place have been sent to the hospital here, from Aplawood down to Angloga, even from Sogakopa down here. So the facility is serving us very well, and we must commend government for doing this. It was difficult, I must confess. It was difficult, especially during the COVID time. But now having that, it will help. It will go a long way to help health administration in the municipality.
Well, they are excited about the facility. As you say, it's a very beautiful facility. They are excited that they can get every service they have here. And also, we have personnel also who are here to serve them. So they are happy that they have a municipal hospital to serve them.
On the whole, we think that the region is so grateful. The communities around for this facility, and we think that this facility can be a game changer, not only in the health sector, but also in the economy of the region.
With continued investment and unwavering dedication, we are building a healthier, stronger community for generations to come.